Millions! That's how much money business owners overspend on healthcare each year by utilizing traditional health insurance plans. It all starts with a general lack of transparency when it comes to the inflated amounts hospitals charge for care. Research shows that typical U.S. hospitals charge on average 3.5 times the cost of patient care. Research also shows that many hospitals often charge northward of 20 times their actual cost, leaving patients liable to pay far too much. For example, a hospital can charge a magnified amount for a procedure while purposely knowing insurance companies have discounts off of those inflated charges, leaving the financial burden on the patients. It goes without mentioning the network restrictions that traditional insurance companies impose, leaving patients with fewer options when it comes to selecting the best provider at a sensible cost. To cap it all off, hospitals often inflate charges even more through out-of-network services. Sadly, anything can be considered out-of-network. This includes equipment, medications, or even the treating doctors. This has caused employers and employees alike to continuously bear the burden through annual insurance premium increases and greater out-of-pocket expenses. The bad news is that these problems are not going away anytime soon. Good news? We at HMA are leading the charge as part of the solution. Value-based pricing is a cost containment program that allows employees to control their annual claim spending and maintain bottom-line pricing. How do we do this? Value-based pricing, also known as VBP, offers self-insured health plans a defined benefit structure designed to be fair and reasonable based on economical reimbursement costs, primarily determined by Medicare. Most traditional health insurance providers negotiate reimbursements based on a hospital's anonymous rates. If a hospital decides to charge $50,000 for a service, the insurance company then negotiates to pay $30,000 without considering what the service is actually worth. Our value-based pricing program instead uses standard rates determined by Medicare to negotiate what your plan should pay for that same service. Under our VBP plan, if a hospital is charging $50,000 for a procedure, but according to Medicare, they should be charging $10,000, our team of experts negotiate a reimbursement that is much closer to Medicare plus 30% to 50%. This means employers' claims cost can immediately reduce from 30 to 50% for the same high-quality healthcare. And if we can't come to an agreement with a specific hospital, no problem. We'll help patients find a highly rated alternative provider with fairer prices that will accept our Medicare plus reimbursement. Best of all, patients get the same benefits no matter where they choose to receive care. Our value-based pricing program carries no network restrictions, and patients can select any hospital they choose. Stop giving into the myth that higher medical costs mean higher quality of care, and start taking control back from the insurance companies and healthcare providers. Allow us to implement a value-based pricing program and see how much money we can save your company today.